what you do, and what made you feel like Salesforce, and what's your role exactly?
I'm Katie. I'm actually a physical therapist, so
Okay,
I don't have any technology
got it.
background, so
Uh-huh.
I'm looking to just
Nice,
learn and meet people. And
nice.
I'm interested in the healthcare and life sciences industry, so I saw this line.
Okay, okay, good to know.
Yeah, hi, I'm Kamal. I work in a Spectrum company here. So I'm more on a Salesforce user, more interested in CRM analytics now, spending a lot of learning in Trailhead, which is a great platform. Self-learning a lot.
Oh, cool, nice. So this is Amol Dikshit. So I've been leading this community group since last more than 1 year now, 1.5 years. So I've been working on Salesforce technology for around 11 years now. So I've also been part of Top Coder Coterie board member, and also presented a couple of sessions in Dreamforce. So yeah, welcome. Mara, can you hear me? Do you want to go next? Do you want to introduce yourself?
Sure. I am relatively new to Salesforce. I left healthcare and working in the operating room. I was a surgical first assist.
Mhm.
I have been studying to take my admin cert and now the BA cert, and I'm going to be doing both of those in the next few weeks. But my goal is to work in Health Cloud.
Oh, that's great. That's great.
Perfect session.
Congratulations on your certifications, by the way. That's cool. Nice.
Thank you.
So, welcome, Mara. Dana, do you want to go next? Do you want to introduce yourself? I'm not.
Sure. My name's Dana. I've been in the Salesforce ecosystem since late 2019, so still, fairly new. I work as a Salesforce analyst for a large hospital organization in central Pennsylvania. Really excited to see this session to learn more about Health Cloud.
Yeah, welcome, Dana. Thank you so much for joining. And today we are going to talk about, as you guys already know, this is the session about Salesforce Industry Solution and Health Cloud. And Michael is going to talk about it. So I will hand it over to Michael now with his introduction and everything.
Perfect. Yeah, so nice to meet you all. Thank you for your time. Appreciate it. I talked to a bunch of customers about Health Cloud, so appreciate the attention to talk to it with you all. A little bit about myself. I actually work at Salesforce. I'm a lead solution engineer. I actually started wanting to go into the medical field as a physician. In college, I was pre-med, and then after I graduated, my plan was to go into the military and go to the Uniformed Services University. But as you see by the red X, it didn't work out. I unfortunately got disqualified for having a bee allergy. So at that point, I was like, do I want to continue pursuing my dream of being a doctor, take out loans and go to medical school, or do I want to start working? So I ended up working for a small startup, and we actually used Salesforce at the time.
Cool.
I was selling maintenance management software, so think of like technicians managing like work orders and parts that they're using. And that side of the kind of my career was a little bit boring, but using Salesforce was really interesting to me. I always liked technology. I always liked tinkering with things. So I gravitated toward the technology. At that point, I had a very narrow view of what Salesforce was. We really just used Sales Cloud. So through that, I kind of made my way up into a sales rep account executive position. And then eventually I made my way to Salesforce. So I started at Salesforce back in 2016. I was just doing business development. I was working our professional services accounts like Deloitte, PwC, Ernst & Young, and really I was just setting up meetings for sales reps. And then from there, I got into the solution engineering role. At my last company before going to Salesforce as the account executive, I was responsible for the entire sales cycle. It was a small startup, so we didn't have solution engineers. So I was doing all of my own demos. And that's the part of the sales cycle I really enjoyed, like the technical side and showing off the software. So going into Salesforce, I knew I didn't want to be a sales rep again. So I got into solution engineering. And because I had that kind of healthcare background in college and I've always had that passion, the HLS vertical really just made sense for me.
Right.
So I've been doing that now for a little over 5-6 years. But I love my time at Salesforce. Initially, Salesforce was launched back in 1999. And I think this history just gives context to where Health Cloud and our industry solutions came from. So as you know, when we launched Salesforce, by its name, it was really a sales tool, managing leads and opportunities, accounts, and contacts. And one of the main benefits of Salesforce was being super configurable. So you didn't need to be a developer or a programmer to configure Salesforce. It was really meant to be, drag and drop, point and click. With that, customers of all shapes, sizes, and types across a lot of industries took Salesforce and kind of tailored it to meet their needs. So people were taking Sales Cloud and Service Cloud and configuring to meet whatever business process that they needed to adjust it for. With that, Salesforce saw an opportunity to actually get closer to the customer. So in 2015, we launched Health Cloud, but there's a bunch of industry solutions. There's Financial Services Cloud, there's Manufacturing Cloud, I think there's a Retail and Consumer Goods Cloud. So there's a bunch of these different kind of industry tools. And as you'll see a little bit later on, these industry tools are built on top of the same sales service platform that we offer, and it's just tweaked to meet the needs of that specific industry. And one really good example is, think about a provider or even a patient. It's hard to model that out of the box in Sales Cloud. You have accounts and contacts, but oftentimes providers work across a number of different accounts. So creating that one-to-many relationship wasn't something we offered out of the box with Sales Cloud. So that's one of the nuances that we've taken the data model and changed it to meet the needs of healthcare and life sciences. Same thing with some of the other industries that we worked. And now if we fast forward to today, we're enhancing Health Cloud for each of the different sectors that we support. And these are the different sectors across healthcare and life sciences. Provider, which is the typical physicians, payer, which is health insurance, MedTech, which is the sector I work in, pharma, and then there's one other, which is public sector. And by the way, if you guys have any questions, feel free to stop me along the way. If there's anyone in chat that has a question,
Of course, yeah.
let me know.
Of course.
So those are the different sectors within healthcare and life sciences that we support. And here are some of the reasons that Health Cloud makes sense for the market. As we saw during COVID, there was massive workforce shortages. I have a ton of friends that are in nursing, and there was kind of a need for nursing staff, hybrid care delivery models. People wanted to receive care in different settings. So with COVID, not being able to go out, being able to do that virtually. Obviously, there's a lot of health inequities across our country. So being able to close that gap. And analytics. I think analytics in healthcare is something that's kind of enhancing and improving. So these are some of the trends that we're seeing that we try to model our tool around. This is a snapshot of what Health Cloud is. A lot of our customers think Health Cloud is a completely separate platform, and they have to migrate what they're doing from Sales and Service Cloud over to Health Cloud. That's not the case, actually. Health Cloud just sits on top of Sales and Service Cloud. It's really just a license that you need. So really any customer, regardless of the industry, they could buy a Health Cloud license, and then they have the permission sets that enable users to access the different capabilities and data models. So you'll see there's some example operating applications kind of in the middle here in the purple. These are some of the use cases that Health Cloud is meant to support. Now, this isn't comprehensive. I have a few more towards the end of the slides, but as you'll see, these are things that are specific to healthcare and life sciences. Normal companies that sell B2B or B2C don't really need to worry about managing appointments or managing a network of providers or managing care or patient services, managing referrals. So what we've done is we've built these applications to sit within Health Cloud. And again, really the goal is time to value. Customers no longer have to customize Salesforce to meet the needs of this particular industry. What we're trying to do is close the gap so they can get up and running on our platform quicker. And all of this is surrounded by all of the other things we're doing on the platform. So there's analytics, there's artificial intelligence, there's mobile experiences, there's customer experiences through Experience Cloud. There's a lot of different ways that the platform enhances what we're doing with Health Cloud, and it's something that we're constantly improving. When we first started selling Health Cloud, it was really for a provider use case. But today we're expanding that across all of the sectors, like I mentioned. So health insurance companies use it, MedTech companies use it, pharmaceutical companies use it, and even public sector. One of the cool things that I didn't realize till maybe about a year ago is during COVID, when you were signing up to get a vaccine, we offered a vaccine cloud, which was like a part of Health Cloud. So if you went to like a website to sign up to get a shot somewhere, some companies, I think actually Rhode Island use that platform.
Even Connecticut, actually.
Yeah, I think Connecticut
Yeah,
might have
because
used it as well.
when I tried to register there, I saw Salesforce there.
Yeah. So it's funny because a lot of times you may be accessing Salesforce and not even knowing it. Another good example, which is outside of healthcare and life sciences, is Hulu. Hulu's like a web portal where you would go in to, maybe look up, how do I renew, or I'm having trouble accessing Hulu. All of that's built on top of Salesforce.
By the way, Dana is saying the company she works for, they have vaccine cloud.
Oh, they do?
Yeah, that's what she's texting.
Perfect. Yeah. Love to hear that. So yeah, there's a lot of different ways that Health Cloud is being kind of tailored. The other thing that's important to healthcare and life sciences, obviously there's a lot of compliance and regulatory concerns. So on top of Health Cloud, we have PHI, it's HIPAA compliant, it's high trust CSF certification. We're able to verify electronic records through 21 CFR Part 11, which comes up often. And the other thing that I think is important to note specifically for providers is it's interoperable, hard word to say, leveraging industry standards. So if you think about just generally connecting Salesforce to other tools, technology applications, you can kind of connect those without needing to go through a standard way of doing it. In healthcare and life sciences, there's the concept of HL7 and FHIR. These are really industry-specific ways of how you need to connect into like an electronic health record system. So with Sales Cloud, you could still make that connection, but you have to build it in a compliant manner, where Health Cloud has that kind of compliant capability out of the box. So that's, again, just another example of what we're doing with Health Cloud, that our customers don't have to keep customizing it to meet their needs.
Yeah, I have one question here.
Yeah.
Like as you said, consider I have a Health Cloud, and if I want to customize something, right? So if I do customizations and all these compliances, right? So if I do any customization, do I need to go through all these compliances again, or how does that work?
I think in some circumstances you do, like the 21 CFR Part 11. I think there's a whole like verification process that you go through. So if you are making changes, you might have to revalidate the application. But for example, like being HIPAA compliant, you can make customizations on the platform, and because the platform's HIPAA compliant, you'll still be compliant.
Got it.
Now that doesn't mean that you could breach HIPAA compliance with the platform. Just because we are HIPAA compliant doesn't mean that you might be using it in a non-compliant manner. So for example, if you have patient PHI and you're not setting up the right profiles and permission sets for only certain users to be able to see that, you might breach your compliance. So that's another thing that I think is interesting. Just because we are HIPAA compliant doesn't mean you're using it in a HIPAA compliant manner.
Got it.
So just something to know. Like I mentioned, similar to our general platform, we're making this better 3 times a year. When this was initially launched, it was really for providers, but again, today it spans across all of the different sectors. So you'll see some of the different enhancements that we've launched over the past few years, and we'll get into some of these capabilities kind of later on in the presentation. This just kind of emphasizes the point of time to value. So again, with Sales and Service Cloud, you still have the ability to customize Salesforce to look like Health Cloud. And actually a lot of my customers in MedTech have done that. My customers have taken Sales and Service Cloud. They bought it maybe 10, 15 years ago when there was no Health Cloud, and they just configured it to meet their needs. They would create a provider record, they would create a patient record. But now with Health Cloud, they don't have to do that anymore. So with legacy customers, we're trying to upgrade them, but it is difficult because they're already kind of so ingrained in Sales and Service Cloud. But with new customers, we're just leading with Health Cloud. And again, it's really that time to value, less customization, and less maintenance moving forward. one of the main things I see with my customers is that because there's so much customization on the platform, they have so many teams trying to keep up with that customization. So this is really meant to kind of reduce some of that technical debt and allow you to innovate quicker. Here's a few examples of customers that are using Health Cloud. This is just a small snippet, but as you'll see, customers across the different sectors. Mimit Health is a provider example. Horizon Blue Cross Blue Shield, that's a health insurance example. Smile Direct Club, MedTech. Novartis is pharmaceutical, and then who's this at the end? Multi-clinic vaccine management. So that's another kind of public health example that we have in here, and I think that's actually through Ireland. So now we'll dive into the actual capabilities that Health Cloud provides. The main two ones that I think make the most sense are provider management and patient management. So with provider management, we have providers out of the box in Health Cloud. And as I mentioned, providers are often different from a normal contact, a normal person. They have different credentials, they work across a number of different clinics and healthcare settings. So we've taken those nuances and included that within Health Cloud. There's a lot of different examples of how companies manage providers, and we'll get into that in some of these next slides. So provider relationship management is more of a kind of provider use case where I'm a provider and I have a team of people that go out and try to get those clinics to refer patients to our clinic. So let's say I'm a dermatologist. I might have a team of people going out to primary care doctors saying, hey, here's my services, here's the health insurance that we accept. If you have patients that have dermatology needs, send those our way. And again, there wasn't really a great way of doing that out of the box with Sales Cloud. Customers were doing it, but they were customizing it. So here, what we've done is we just added the provider data model along with a referral data model to allow for this type of management and tracking. So that's one use case really centered around providers. The other one is more of a health insurance use case, provider network management. So the overlap here obviously are the providers, but from a health insurance perspective, health insurance companies need to manage a whole network of doctors that accept their insurance. So this application has things around credentialing and recruiting and managing that large network of providers. There's even, and I think I have this a little bit later on, capabilities around managing claims and utilization and benefits. So again, just another kind of nuanced way that Health Cloud tracks provider relationships. Again, contrasting to Sales Cloud, where you have accounts and contacts, and you could call those hospitals, clinics, and you could call the contact providers, but it doesn't account for all of these kind of nuances here. The other thing that I think is important is managing patient relationships. So obviously a patient could be a contact, but oftentimes, and I've seen this with two different use cases specifically. With a pediatric use case, you have a patient, but oftentimes you're not calling the kid. You're talking to their parents or their guardians or their loved ones, whoever is managing them, and there's not really a great way of doing that with just a contact record. Same thing with behavioral health, addiction treatment centers. Oftentimes the patient is the person that's needing treatment, but it's difficult to often get them to enroll in the treatment. So you're often working again with their parents, family members, maybe even school administration to get that person enrolled into some type of program. So again, this household data model really is meant to represent the patient in the middle, but you have all of these other people and providers and stakeholders around them to help with the care of this patient. So again, this is actually tracked as a person account. So person accounts isn't something new. A lot of our customers in a B2C scenario are managing their consumers through person accounts. And again, this just tweaks it a little bit and adds the nuance of the patient. Care plans, that's another thing that's kind of unique to healthcare, specifically providers. Oftentimes, once a provider sees some type of patient, they prescribe them some type of care plan. So I actually hurt my knee playing soccer over the summer last year, and then they put me on a care plan of going in, getting PT a few times a week, And again, there's not a great way of doing that in just Sales Cloud. So we have these care plans in Health Cloud to manage kind of the life cycle of care for a patient. So in here, you have different tasks and milestones that need to be completed. And these things can actually be exposed through an experience portal. So not only me as a provider can I prescribe this and document it, but I can expose that to the patient so the patient can see this information. They can interact, they can cross off when they're doing things. So again, it allows for that type of engagement that you don't have with some of our just core platform. Patient timeline, we have the activity timeline in Sales and Service Cloud, which is really tracking emails, tasks, events, but it doesn't track things like clinical encounters. This is where you can really see the integration with the electronic health record. We can pull in those clinical encounters and view those on a health timeline. So again, something that you're really not able to do just with Sales and Service Cloud, but we're able to view kind of this chronological view of what's been going on with this patient. Are they seeing other doctors maybe within our network? What are our upcoming tasks, upcoming encounters, upcoming appointments? All of that can be seen there. Appointment management, this is another thing that we offer. So appointments often are done through the electronic health record from what I've seen in the past. Oftentimes there's challenges with that scheduling tool in the health record system. So we've offered this as the kind of engagement layer that sits on top of the health record. So you can allow for self-scheduling, or if a patient calls in, you can schedule on their behalf. There's a number of benefits of doing this on top of Salesforce and connecting this to the EHR versus just doing it in the EHR. There are some kind of overlaps. I know I've often had conversations with customers that have Epic. Epic has a customer portal. I think Epic has scheduling capabilities. So sometimes there's that kind of friction of what tool do I use? And if they're already using kind of scheduling inside of Epic, my experience, it's hard to get them to switch over to Salesforce just because they're just so much momentum with what they've already built. But again, there are benefits to doing this on top of the platform. One cool thing that actually my dentist does is they connect this to like text messages. So like when I have an upcoming appointment, it'll send me a text. I can then schedule when I'm going to be free. I then get reminders a week before, a day before. I can then check in on my phone. There's a lot of cool things that you can do with our appointment management tool that you may not be able to easily do inside of the health record system. The other thing to kind of think of here is the health record system historically requires a lot of customization. So if you want to make changes, you want to do different innovative things, it can be really intensive, a lot of resources, a lot of time to build that out. And again, because Health Cloud is built on the platform, a lot of the customizations we can do are just point and click, drag and drop. Utilization management, so I touched on this a little bit. So this is really our health insurance data model, so managing claims from a health insurance perspective. But I've actually seen this in the MedTech industry as well. One of my customers I was working with last year, they sell orthopedic braces. So think of like a knee brace or an arm brace, something like that. What the process for them was, after a doctor gave a brace, dispensed it to a patient, they were sending paperwork back to the medical device provider, who is then looking at it, making sure all of the information was complete, sending that over to the payer to then get reimbursed. It was this whole long manual process. There was a ton of paperwork. And with this, it can reduce a lot of that complexity. So we're able to, maybe receive that information through a portal, make sure we have all of the information. There's even connections to a lot of the major payers through one of our partners, Change Healthcare, to allow for the insurance verification, allow for things like pre-authorization. So there's a lot of cool things that are baked into this health insurance data model that's used across the different sectors in HLS.
So sorry to interrupt, Mara has a question.
Yeah.
Like, can this be layered with Epic?
Yeah. So Salesforce has the clinical standard for integrating with Epic. It still requires some type of integration to be set up. I believe Epic in their App Orchard has some type of pre-built connections to Salesforce. And I know with our integration tool, MuleSoft, I think we have some pre-built connections.
Okay.
Now, I haven't been as close to providers as of recent, so I'd have to double check that, but I'm pretty sure we have some pre-built connectors. And for data that isn't included in those pre-built connectors, you could still create some type of like API to connect into.
Got it.
Now, the problem historically has been, does Epic want to integrate with us? So we try to keep our platform open, but oftentimes Epic wants to create boundaries and not integrate with our platform. So again, sometimes there's some competing things, and I think Epic even has a CRM nowadays. So again, a lot of competition and a lot of friction sometimes, but that doesn't mean that it's not technically viable. It can be done. It just requires conversations and a partnership with them.
Got it.
Thank you.
No, that's fine. So if you guys need a password, you guys can use this. Thank you. Yeah. Sorry, go ahead, continue. And Dana has another
Yeah, yeah.
question. What about Cerner?
Cerner. So we actually have a partnership with Cerner. I was at the Cerner Health Conference in Kansas City a few years ago, where we had a booth. We partner really closely with Cerner, so our ability to integrate with Cerner is much better than our ability to integrate with Epic. We have that strong partnership, and in instances where a provider may be looking for a CRM, Cerner will refer them to us. And same thing, if we have a provider maybe looking to update their EHR, we'll recommend them to Cerner. But because that's a big competitor to Epic, that's where the friction comes from.
So basically, Salesforce has integrations with almost all the healthcare providers.
Yeah. And if we don't have like an out-of-the-box integration, we still do have that open platform where you can create custom bridges to kind of get that data back and forth.
Got it. Thank you.
Benefits and eligibility verification. I touched on this a little bit already, but being able to verify benefits. Our partner Change Healthcare, I was showing this to a customer, I think last week. They have over, I think the number's like 2,400 health insurance providers that they have pre-built connections to. So most of the major providers that you may work with, we can connect into them with our Change Healthcare ISV partner. And I think I have a slide to talk about ISVs, but I'll just kind of talk about it for a second. ISVs are independent software vendors who are building applications on top of our platform. Think about on your iPhone, you have the App Store, and through that App Store, you can access a bunch of different apps that a bunch of companies are building outside of Apple. That's essentially what our App Exchange is. It's a really platform for different companies to build business applications that either connect into or sit directly on top of Salesforce. So Change Healthcare is the one that we partner with here to connect into the different payers that allows for the things like benefits and eligibility verification.
Got it.
So this is getting into more of my area of expertise as of late. I'm working in our MedTech vertical. I support our enterprise MedTech accounts. So think of all the big, MedTech companies out there: Johnson & Johnson, Invisalign, actually, Stryker. All of those are big MedTech companies. MedTech companies often have a different need for forecasting and managing the business that they do with providers. So intelligent sales forecasting and sales agreements, which I think is my next slide, is something that's unique to MedTech. So in MedTech, oftentimes what happens is that they sell kind of two main types of products. There's big capital equipment products. Think of like an X-ray machine or maybe even like a surgical robot. Those can be tracked easily through things like opportunities. But when you get into more disposable type products, think of like, I don't know, something that's used in a procedure like a screw or maybe even an artificial knee. That type of device isn't really tracked great through an opportunity. So what we've done is we've created sales agreements, because oftentimes what happens is the MedTech company will create an agreement or a contract with a provider. Let's say the Stamford Hospital has a contract with a MedTech company to buy devices over a 3-year period. Oftentimes what they're doing is they're saying, hey, every month we're going to need 1,000 syringes, 200 artificial knees, 5,000 screws, whatever it might be. And again, there's not a great way to track that in just Sales and Service Cloud. So we have this ability through sales agreements and sales forecasting to allow for that tracking of that type of business. So again, opportunities don't really match this. Customers are kind of tweaking opportunities to track this type of information. But again, this is really meant to be an out-of-the-box solution that our MedTech companies can use to really track that aspect of their business. Sales visit and inventory management. This is another nuance to MedTech. So when you think of, a procedure that's going on, let's use like a knee replacement, for example. Oftentimes what happens is the actual MedTech sales rep is bringing devices to the hospital for that procedure. So this is really meant to track that use case. So doctor calls in, or maybe, the OR administrator calls into the MedTech company. They say that we need these types of products. What typically happens is they schedule that visit, that procedure, they associate it to the appropriate rep. The rep can then see what the procedure is, all of the products that's needed. And typically they refer to this as like a trunk stock. And they have basically like a toolbox that they're bringing into the operating room to give to the doctor to leverage whatever products. Once those products are consumed, they may not be using everything that's in that toolkit. That is then invoiced. So this is really meant to track that part of the process. And again, there's really no way of doing that on top of the core platform without heavy customization. This is getting into more general tools. So intelligent document automation is actually through an acquisition, I'm getting ahead of myself. Intelligent document automation is our partnership with Amazon. This is allowing really paper documents to be ingested into Salesforce. So whether you're uploading a paper document or you're faxing it over, this capability allows for the extraction of that text into Salesforce fields. So, for example, maybe a patient is getting referred into another provider or getting referred for some reason. Oftentimes in healthcare, there's a lot of paperwork still. So that paper ends up going to whoever that end customer is. And then typically there's a team of people that's just typing that information into systems. This completely automates that process. So what we do is we set up matches of looking at, let's say, patient name. And anytime we see patient name, we can extract that into the patient record. And think of all of the other information like insurance or date of birth, whatever it might be, that information, instead of being typed into Salesforce, can be extracted. And
So do you need to configure these rules somewhere? Because every company, every hospital will have different forms, right? So information might be captured at some different place. So.
Yeah, so you have to set up that matching. So for example, name, the field label might be different across all of the forms that you're getting. It might be name, it might be first name, last name, it might be patient name.
Right.
So you're gonna set up, when you see that label, then put it into this field.
Okay.
And as you enter that information, this is actually connected into some of our AI tools. It'll just get smarter. So it'll track that and get better moving forward.
So this feature provided by AWS, like Amazon?
Amazon TextRact is the name of the service that we're partnered with.
Got it.
Yeah.
Thank you. Because there are so many like third-party services, like example like Doximo, and also they do the exact same. So this is pretty cool.
Yeah, this is an on-platform tool that we just came out with, I think like a year or two ago.
Got it.
Really cool technology.
This is really useful because it will reduce all that manual efforts. Like, really
I've seen med tech companies that have like a whole, think of it like a call center of people that are just taking documents and typing into systems.
Right.
I hate to kind of sell this as like, oh, you could like cut that staff, but you can definitely automate a lot of this. So.
But like, just one more question here. Consider like, if the system is not able to find the information, so does it go for any approval or something?
So you're able to set up thresholds where if we're not finding the information, or maybe the information doesn't look completely accurate, it'll flag that for an end user to be able to review. They can make a change or enter in the information and then save it. So it doesn't necessarily automatically save. In instances where it's like 100% accurate, it'll save, but you'll set up a threshold where it's like, If it's below 80%, then flag this for the end user
Right.
for them to be able to
That
review.
makes sense. Yeah, thank you.
And that's it. So that's a little bit about Health Cloud. That's really just scratching the surface. I wanted to provide just a few examples of capabilities and customers that we're doing it for. But if there's any kind of specific questions that you all have, I'm happy to try to answer.
Yeah, so guys, if you have any questions, feel free to ask, like Mara, Dana, the people who are joined online, virtually, or here.
Can you please tell me something about HIPAA, which I've just seen here, the HIPAA workspace? What is that?
HIPAA workspace?
Yeah.
I don't know what you're referring to. What are you referring to exactly?
I was just saying like this, the last slide which we had.
HIPAA compliant. Oh, so
Compliance.
Health Cloud as a tool is HIPAA compliant. So I think this is just referring to, because we're pulling in PHI potentially in these use cases, patient data, because Health Cloud is HIPAA compliant, you can do this in a HIPAA compliant manner. If you're just using Sales and Service Cloud, it's not necessarily HIPAA compliant. So Health Cloud has that HIPAA compliance certification. So as we're ingesting things like PHI or PII, you're going to be covered. Something that I mentioned earlier is just because our platform is HIPAA compliant doesn't mean that your company is using it in a HIPAA compliant fashion. You still have to set up the right roles and permission sets to ensure that only a certain people can see that kind of protected sensitive data.
So well, looks like there are no questions. By the way, thank you so much, Michael, for this like very, very informative session. And actually, I would like to give you something because as you promised, like this is the small thing as you have presented the session.
Amazing. Thank you.
If you guys want to present any session, feel free to let me know. And so I've got some things for you guys too. These are like, I'm not sure if I have enough, but whatever I have. So feel free to, this is for you guys. Just feel free to take it. These are all small swags. So, I mean,
Michael, I have a quick question.
Yeah.
This is Mara. So can you recommend, since I want to work in Health Cloud, can you recommend what certs at this point I should be looking at from your standpoint?
Maybe let me ask a question to understand. When you say work with Health Cloud, in what capacity do you want to work with Health Cloud?
I don't know yet. This was really interesting. I haven't seen a presentation like this yet, but I do jump on like the Health Cloud other meetings, like with there's other people, like I've had meetings with Becky Thomas, who's now at Salesforce, but she worked with Coastal Cloud and Health Cloud. So I know there's a lot of different arenas in this, and I'm just learning about that now. So I'm just trying to figure out the right path to work in this specific field.
Yeah, so a few thoughts. Partners like Coastal Cloud have to go through a certification process to be able to be one of our preferred health cloud partners or implementers. So if that's the direction you're looking to go, there's definitely like partner certifications that we offer that you could get, but that's more of like implementing Health Cloud. There's also, probably, I don't know if there's any other, I think there is a Health Cloud certification that I think I actually helped write some questions for a few years back. Let me see if I can find something.
With that cert, you can only take it like if you're, like I can't just randomly take that right now. I was told like I have to be working for a partner.
Yeah, so yeah, I think I just pulled it up on the screen. There's this Health Cloud specialist.
That Trailhead, yeah.
Yeah, through Trailhead, but I don't know of any like kind of official certifications. There's like all the Trailhead stuff that you can go through. I think that's probably your best bet. Just going through Trailhead, seeing all the different trails that you can take. And then if you're trying to get into more of like that partner ecosystem, I think there is that like certification you need, but this Health Cloud specialist probably covers a lot of what you're looking to get, at least from a foundational perspective. Because
Okay.
there's like data models and care plans. Yeah, so there's a lot in here, especially if you're looking at it from a provider standpoint. I think this probably is a good start.
Okay.
Because I don't, let me see, yeah, super badge. Yeah, I think there's just the super badges. I don't think there's a particular,
We don't have any.
yeah, no. I'd imagine in the future that's something we'll build out. We have a lot of certifications, as you'll see, for like some of our other, I guess, complementary tools like CPQ, which is our quoting platform. But I don't think we have a health cloud one as of yet.
Do you have any certifications, health cloud certifications?
No. I just have admin certification and app builder certification.
Okay, got it.
And then I have like my internal certifications through Salesforce. Like I'm analytics certified, and I'm also Omni Studio certified,
Got
which is Omni Studio is our acquisition that we had through Velocity.
Yeah, right.
So yeah, but those are more internal
Right.
certifications.
Maybe if you know someone who knows a little bit about healthcare certifications, maybe we can have a session.
Yeah.
Let me know if we can
Okay.
have session around that if you know someone.
Sounds good.
Well, thank you so much for joining, guys. And as usual, actually, we'll order some food, whatever you want to order. Please
Okay.
feel free to order there.
Oh, cool.
My tab is already open,
Awesome.
so feel free to do that. And thank you so much. Thanks for
Yeah.
joining.
Thank you, everyone.
Thank you so much, guys.
So very well put together.
Oh, thank you.
I'm sorry I was a bit too late.
No worries.